My name is Candace Giesbrecht, and I'm the director of the Remote Performance Academy with teenit.com. And I'm here with my friend and my former coworker, Aaryn Secker. Aaryn, what's your title at CMHA?
I'm the Associate Director of Education and Health Promotion.
When a big tech company like Hootsuite comes out with like a really big, bold move, then people sit up and pay attention. And so my first reaction was like, okay, like they're putting their money where their mouth is. They're talking about not just what they're doing, but they've done their homework clearly, and they're making some pretty bold moves here. What did you think when you read it?
Yeah, I agree. I think pretty mixed. There's a lot of really good stuff in there, to be clear, and it's super educational, which I also appreciate because I think they make a really good case for why they're doing what they're doing, which I think is super important to highlight. They highlighted a lot of important movements over the last year and a half.
Yeah.
They really said mental health needs to be the center of what we're talking about and our next steps forward. So overall, like really, really happy to see that piece come out. But like you, there's probably a couple things in there where I'm like, oh, well, I don't know if that's the focus or where I'd put the focus. But, I want to be clear. This is about Hootsuite giving people a week off in July. And I don't want the pitchforks to come out and say, like,
No.
Aaryn and Candace don't want people to have a week off.
Nope.
That's not it at all. But there's a couple other
No.
things I think that were kind of buried in there that would be interesting to talk about.
Yeah. Okay. Hootsuite they've driven like some stakes into the ground, saying like we really really care about this, and they've one of the big sort of headlines in the blog post is organizations have a responsibility to prioritize mental health. Do you agree with that?
Yeah, absolutely. Yeah, absolutely. And they mentioned that this line between work and the rest of your life, it's blurring. It's not reasonable to keep a whole huge barrier between those. And I absolutely agree, whether you're working from home or not. Our lives are very complex and multifaceted. But we also do still spend a lot of our time at work or thinking about work or with our colleagues. And, one of the things we've been saying at CMHA forever, it feels like, is that you can't have a mentally healthy community if you ignore that whatever it is, 90,000 hours that people spend of their life at work in their lifetime, right? We can't ignore that huge chunk of time and then expect people to do well, be healthy, have great relationships outside of work.
Like, yeah, and all of that. And like there is that, so they make the social case, which I think is so important, and they also make the business case. And so, for the companies who are reading that going, great. Now Hootsuite's got this plus like, and like matching programs and all this kind of stuff, which is amazing. What advice do you have for the small to medium sized like businesses when, as they're probably going, like their heads are probably just in their hands?
Yeah, well, and the article that Hootsuite put out had some really important points in there. They're talking about how a lot of folks, especially during the pandemic, were not taking their vacation time that they did already have, right? They're not taking the sick time that they did already have. And I think that that's a good reminder to us to actually look at our internal workplace culture. So it's one thing to offer all the bells and whistles, and that's wonderful if you can do it. But even if you offer them, what are people able to actually take up? What are people actually using? And so I'd say to some of the small and medium-sized businesses, look at what you are able to offer, and
That's
then
awesome.
what do you need to do to make sure that people can actually take advantage of that, can actually use that? Because how many workplaces give you sick days or give you some vacation or tell you your day starts and ends at this time, but then leadership doesn't walk the talk, right? Or it's actually frowned upon if you do take that time. So I think, offering more is great, but if people are not using what you already have available, there's a lot of opportunity there for your culture to improve.
What you just mentioned reminds me of in the past, I have reached out to benefits, our benefits provider, and asked for analytics. And I think many companies either don't know or forget that there's data right at their fingertips. And so on the one hand, I think there can be reluctance, and for good reason, around asking people, or so certainly the data around vacation time, sick time, stuff like that. Like, are people getting rest? And but sometimes when a boss is asking you, are you getting the rest you need? Like there's this there's stigma, but there's also also just that I don't want to tell my boss I'm not well right now. And part of it's stigma, but part of it also is just like I don't want to say that. I don't, I'm not ready to say that yet to my boss because of all that that can mean. You know, maybe I just don't want to have that conversation with my boss
Yeah.
yet. Or,
Or
you know, and
or I'm just confused, right? Like I haven't felt this way. What does this mean? You know, it doesn't feel like I've felt before when I've been stressed or anxious. It just feels different. It's landing different. And we get really stuck there sometimes too, right? It just becomes the normal for you to
yeah,
feel drained, to feel fatigued, to feel disconnected. So I think it's being able to recognize that. And then, like you're saying, also be able to actually talk about it.
yeah,
There's a lot of data available to employers to make these informed decisions and to understand how their teams are doing. They won't know about you personally and what you're accessing, but absolutely that data is there and should be informing what we're doing with our teams. And then also just even that perception around, again, the use of sick and vacation time. I don't know
yeah,
if you've had this, Candace, where you talk to a manager or an employer and they almost are boasting that no one takes sick
yeah.
time. And of course, we know people get sick. I mean, you know, again, during the pandemic, a lot of folks were saying, oh, I haven't had a normal cold or flu, and that's different, of course. But pre-pandemic, people were getting colds and flus. There's seasonal stuff we're all expecting. And if no one is taking sick time, we just know people are showing up to work sick. And then now as a lot of workplaces are shifting to work from home, that also might be a difficult conversation, right? What does sick time look like? If, I mean, I could wear my pajamas and work from the couch. Am I really still doing my best work though? Am I resting like I need to? So encouraging people to take that time for themselves, even if it looks different now or your work environment looks different now.
Yeah, yeah, that's a great point. What are some of the, again, thinking about those small to medium-sized employers, like what are some of the resources that they might not know about that are available to them?
Yeah, so one of the ones that I really like to promote is Bounce Back, and Bounce Back is actually available Canada-wide right now. So that's one of the benefits of some funding from the pandemic. So Bounce Back is an online or a telecoaching service for people experiencing high levels of stress and mild to moderate depression and or anxiety. And so you could go on right away and get started in the virtual program, or you could also talk to your health professional or nurse practitioner, your doctor, walk-in clinic about the telecoaching option and get a pretty quick referral there. And they'll send you some really great materials and connect with you over the phone to help coach you through whatever it is that you're currently experiencing for yourself or also for your family members. And there's a youth version of that available too.
Cool.
So that's a really great resource, and that's completely free to access. So yeah, give it a go.
Yeah, yeah. What's the downside, right?
Yeah,
Yeah,
absolutely.
totally. Well, let's get back to this article here and uh, work-life integration over work-life balance. What does that mean to you?
Yeah, I'm a little skeptical in some ways about some of the language. It's tough for me. I definitely agree that we need to look at our lives holistically, and the expectation that you can just park everything at the door, whether you're coming to work or leaving work, that's certainly not a realistic expectation for people. I do think we have to make sure that we're not using it as a reason to reduce people's boundaries, if that makes sense. So we can't just shrug and say, well, everything kind of blends together now, and that's just how it is. I think we still actually have to look at where the boundaries do come into play, and maybe that's not the way it used to, where you open a door and walk through a different office building and that's where it starts and stops, but still having boundaries around your time, right? Are you checking your emails at all hours? Are you expecting your staff to check their emails or pick up their phones at all hours? I was just talking to a group earlier this morning where he mentioned that sometimes, as managers or employers, we send that email off at Friday at 7 p.m. or Sunday morning at noon, and we don't expect a reply, but our staff might still think that we do, right? Or there's still this perception that I'm so busy, right? And I don't have these boundaries, and that affects them as well. So being really clear about what the expectations are, saving things into a draft or a schedule so they go out on Monday instead. Those are things that we can all do, and actually just walking the talk around that and being a real role model about that.
There were a bunch of other things within this article that just sort of, popped for me. We're going to include a link attached to this video. But I just wanted to kind of give you the floor, Aaryn. Like, when you looked at it, what popped for you?
Well, I think they kind of bury the lead a little bit in there, right? Of course, talking about one extra week off and everyone having this reset week, that's easy to put in a headline, and that's attention grabbing. But really, actually, the bottom of the article is some of the stuff that really stood out to me around. I think there was a note there about, yeah, they expanded their mental health benefits quite significantly. And again, I know not every employer can do this, but
Yeah.
they talked about that they did, and they prioritized that. They mentioned culturally safe
I was
care, right?
like,
Trauma-informed counseling and
wow.
care, which again is just something that I think any workplace can really look into and actually just learn more about a trauma-informed practice and what culturally safe even actually means. So whether that's in your benefits or not, you can still do some work and educate yourself on those topics. Yeah, so just part of it is recognizing that people show up with histories, right? People show up with experiences, and those experiences are going to shape how they are in the workplace, how they're perceiving everything that's going on around them. And just recognizing that everybody has these unique experiences, and being able to hold a space for that without judgment, without expecting everyone to be the same, act the same, have the same perception day in and day out. So just really getting to know your people and getting to know what it is that they're bringing with them to work, and being patient and being caring and actually listening to folks. It really can just be those things that I think all of us try to do or we want to do, but we get caught up in being busy, in our own stuff, in our own lives, our own deadlines. But just recognizing that everyone is an individual, trying to actually listen, ask people what they want and what they need when it's possible, have that spirit of collaboration where you can. And that's going to look different in every workplace. So I can't give you a flow chart, but it's really just respecting people as people is really what a lot of this is coming down to.
Yeah, this has been awesome, Aaryn. Thanks for taking just a few minutes to chat about this. If people wanted to follow up with you and find out about how CMHA could be helping them in their workplace mental health strategies, how can they reach you?
The plug, yeah. So there's a couple options. CMHAKelowna.org is our primary website, and that you can find the offshoots for all the great stuff that we do, including Discovery College, which is community education. Everything's virtual right now, free to access as well. So check that out. And then our workplace strategies in particular, it's thoughtful with 2 L's. So thoughtful with 2 L's. .cmhakelowna.com, and then you can find all the great stuff that we do there, and you'll find my email address and contact information there as well.
Awesome. And we will include this as well. And I think, just maybe as a final comment, Aaryn, the thought that you're leaving me with is just that reminder of like our experiences are all different. And that includes not just other life experience, but even of the pandemic. We've not all had the same, just because we've all experienced the pandemic at the same time, doesn't mean we have the same experience of it. And the people that are returning to, if they're returning to a specific workplace, likely they're not the same people who left. I know many of us are changed as a result of this experience. And so I'm grateful, Aaryn. Thanks so much for your time and for your thoughts.
Yeah, thanks so much for having me. This was fun.
Okay.